Hello, Incredible Moms. This is Crystal Evaristo with the Incredible Moms podcast, where we discuss getting pregnant, being pregnant, having babies, being a mom, and so much more. We hope you enjoy the show. Hey, everybody. I'm here with Sarah, and she is the first one on our podcast, and she's going to tell us all about her and her pregnancies and her babies.
Yeah. Hi, I'm Sarah Boyle. I have 4 children. I'm a stay-at-home mom. I actually homeschool my children. Actually, I'm kind of like one of those yes people. So I have all these different things that I do. I like admin a local moms page, and I like to have exchange students. Last year we had an exchange student from Spain. I actually foster kittens. I'm just a yes person. Here I am doing this podcast. But I just kind of wanted to, I guess I'll start from the beginning. I have 4 children. My oldest is 8. I'll say that when my husband and I got married and we first started trying to have babies, I had a hard time getting pregnant. We tried and I couldn't get pregnant. So we ended up moving to Florida for a little while, and I got a job where I actually had some good health insurance. So I went to a fertility specialist, and that's when I got Clomid. We actually used Clomid and Ovidrel. So the doctor would, I'd take Clomid at the beginning of my cycle, and then around day 12, he would check me with the ultrasound and check my follicles. And if they looked good, he gave me a shot in my stomach to make me ovulate. So he would say, okay, have sex the next 2 days.
So he would put the shot into your stomach or through your vagina?
In my stomach.
Oh, wow.
Yeah.
Directly into your ovary?
No, it was actually just in my belly, my fat, my little,
okay.
It was a nurse that did it.
Okay.
Yeah.
So not like one of those long needles that goes in and does anything.
No.
Okay.
It wasn't bad. It was just a quick little shot. And I guess that's what would tell my body, okay, ovulate right now.
Okay.
Because I wasn't ovulating myself. So I don't know if maybe that shot was just extra, a guarantee that I would ovulate.
Right.
I got that shot, and then he really did say that he had an accent like that. And he would say, okay, have sex the next 2 days. So
lots and lots of sex.
Yeah. So we did. And the first time it didn't work, I was super bummed. And we were doing all the things that we were supposed to do too. We had that special lube, the pre-seed. We had the lube. I was laying there afterwards with my legs in the air, and we were doing all the things, but it didn't work. So then we did another round, and that round actually worked. So I ended up getting pregnant with my first.
How long in between injections, or trying, did you have to wait? Could you try immediately the next
It was
month?
immediate. Yeah.
Oh, okay.
So as soon as I started my period, then it would start a new cycle, and they would tell me to go ahead and start taking the Clomid again. I think it was weird days that I had to take it. I don't know. It was maybe day 5 through 7, the first couple of days I had to take a certain amount, and then the next couple of days I had to take a certain amount of the Clomid, and then I didn't have to take anything until day 12. That's when they would check me and make sure that everything was, my follicles looked good. Yeah, everything was looking great. And then I got that shot.
Okay.
Yeah. And then when I got the positive pregnancy test, then I just called them and told them, and they actually had me start taking progesterone.
Okay.
I don't know.
So injections or vaginal?
Actually, neither. It was just something I could just swallow, just an oral medication.
Nice.
And I don't know why. I feel like maybe because it was a fertility specialist, a lot of the people that he had issues with miscarriage, and maybe it was just kind of a precaution, take extra progesterone so that you don't miscarry.
Sustain the pregnancy.
Yeah. So I did do that too. They had me start that immediately when I got the first positive pregnancy test, and then I ended up seeing them every couple of weeks for appointments until I got to a certain, I think it was 12 weeks. Mm-hmm. And then I could move on to an OB.
Okay.
Which I did. And it's kind of I was new because we had just moved to Florida, and I didn't have any friends or anybody to ask about birth and about OBs and who's good and what should I do type of stuff. Mm-hmm. So I just remember actually looking through, not an actual phone book in my hand, but online, you Google OBs and just looking at these people, I mean, how do you even know if they're going to be good or not? You just are looking at their pictures, right? Like, right. Okay, well, she looks nice.
I know. It's not like you have like back then too, 8 years ago, they didn't have like big forums of like rating different OBs.
The only thing we had was, what was it? It's kind of like babycenter.com, you know, right. Those were the forums, but they were so big. They weren't local, you know, like you're talking to people from Australia and the UK.
Right. They do things way differently.
Yes. Oh yeah. They would use all these weird words too. I'm like, oh yeah, that person's from overseas. I don't know what they're talking about. They're talking about a pram. Like, I don't know what a pram is.
I only know that because I watch Call of Midwife religiously.
Yes. So yeah, I just kind of picked an OB out of the hat and I saw her. And I guess I wouldn't say I was young. It doesn't seem young, but maybe to them I was young. I think I was 21. Oh. So I felt like the first lady that I saw, I don't know how to explain it. I just felt like she didn't take me seriously. Like I don't know. She'd never even like really stayed in the room with me very long. So I ended up switching after a couple months. Yes. The first OB that I saw and I was like, okay, well I just don't feel a connection here.
Right.
And I didn't know anything about birth, but I felt like maybe I should feel comfortable with the person at least, you know? So I ended up switching to a different OB and she was more talkative and more, I don't know, she made me feel more comfortable. So I ended up going with this other lady and again, I knew nothing about birth. So towards the end of my pregnancy, I had a total normal pregnancy, by the way. I mean, everything was fine. I was large, you know, but it was
like most of us.
yeah, exactly. But it was totally normal. At the end of the pregnancy, the other thing too, I didn't know to ask any questions. I didn't know to be like, what's your C-section rate? You know, like, what would you do? I remember people talking to me about birth plans and I would just be like, well, I'll just do whatever the doctor tells me to do. I didn't take a class. I didn't even really want to read anything about birth because I didn't want to freak myself out. Yeah. So just like, you know what, whatever happens. I'll just, you know, the doctor knows what to do. I'll just do whatever she says to do. Mm-hmm. That's literally how I went through that first pregnancy and birth. So what ended up happening was at the end of the pregnancy, she was just like, okay, well, you know, I can induce you if you want. I'm like, heck yeah. Like, let's just go ahead and get this sucker out.
Right.
So she's like, okay, how does Thursday look for you? And mind you, I mean, I wasn't overdue or anything. It was just like, okay, well, this is your due date. Let's just go ahead and get that sucker out. And so.
Do you remember how many weeks you were?
Okay. So that's a good question because I didn't even mention this. So since I was seeing a fertility specialist at the beginning, clearly I knew exactly when I conceived.
Right.
And I actually had the due date from the fertility specialist. I saw him until I was 12 weeks. And then all of a sudden, when I switched to this new doctor, you know, she gave me another ultrasound and it was like, oh, well, let's give you this new due date. And it was a week earlier, which, I mean, okay, babies all grow at different rates, but you can't, I mean, you know exactly when this was conceived. I mean, we know exactly how far along this pregnancy is. You can't really just change the due date because.
If you had any question of when it happened.
Exactly. But again, I didn't know to question anything. And in my mind, I was like, okay, great. I'm going to have him sooner. Right. You know, and not realizing that new moms especially usually do go over. I was just cutting myself short a week. You know, I really was doing myself a disservice by being like, oh yeah, sure. You know, right. I had no idea. I was just excited. I'm just like, oh yeah, now I can tell everybody I'm going to have him a week sooner.
Right.
So anyway, and then, yeah, she induced me and there was no reason for it. I was like completely closed. I wasn't even dilated whatsoever. No reason for it. I went in the morning. They went ahead and put me on Pitocin. I was on that for like maybe 2 hours before they broke my water. I had dilated enough to just break my water. And I'm trying to think. So this all was actually started they broke my water. I want to say it was like 8:00 in the morning, like between 8 and 9. And then I did end up getting the epidural. The Pitocin was terrible. I mean, and they wouldn't let me get up at all. Like they just made me lay in that bed. I remember telling my husband, like when I get up to go pee, it feels so much better. Like it's a relief when I get up, when I stand up.
Right.
Oh no, they would not even let me stand just next to my bed. Like I had to be in the bed, laying down, like not even like doing anything in my bed.
They let you get up to the toilet too. That was pee.
They did let me get up to go pee. And they were super annoyed every time that I did. The nurses were actually pretty terrible there. They were annoyed every time. I felt like, okay, I can't go pee yet because I just went pee 30 minutes ago and they're going to be mad at me.
But sometimes you're like, oh, she just went 30 minutes ago. I'm like, do you know what it feels like to be pregnant and have to pee?
Right.
I'm like, we have to pee all the time. Like,
yeah. Yeah. And especially in labor, like, and the other thing too was that I didn't know. And I'm kind of a people pleaser. So I'm like, oh, I don't want to make anybody upset.
Right.
I'm not an advocate for myself, or at least I wasn't back then. And I didn't know anything anyway to advocate. So I just kind of was like, okay, well, I'll just lay here. And then around, I was at 4 centimeters for a few hours, which in hindsight, knowing what I know now, that's not weird. You know, that's very normal. Typical. And then I remember the doctor coming in she came in at 5:30 and she said, okay, well, you should have progressed more by now. I'm going to give you another hour. And if you haven't progressed in an hour, we're going to go ahead and give you a C-section. So, and I cried because, I didn't really know what I was doing, but I did know that I didn't want to have a C-section.
Right.
So yeah, I cried and I just really prayed like, oh my God, please. Like, I need to start dilating. So she came back and checked me in an hour. Lo and behold, I was 5 centimeters. Oh, but then she's like, that they had the OR ready. They had the OR ready for me. And she looked at me and she's like, well, really, you should have progressed more by now anyway. So we're just going to go ahead and take you back. And that was it. They took me back and I had a completely unnecessary C-section. And, and I don't want to harp on C-sections, but it's not ideal. And it wasn't what I wanted. And especially if it's not necessary. I mean, obviously if it's a necessary procedure, then everyone wants a healthy mom and a healthy baby. Duh.
Right.
And sometimes it saves lives, obviously, but mine was completely unnecessary. And I remember they took the baby out of me. They didn't even let me see him at first. They held him up over the curtain, and then they took him away to do all the checks and wash him and do all this stuff. And it's 20 minutes. And I was screaming, actually. I'm still strapped down. They're still playing with my guts. And I'm like, where is my baby? Where is he? Is something wrong? Where's my baby? Right. So finally they brought him over to me and showed me, but I was so hopped up on pain meds and everything, by the time they were wheeling me, I remember them wheeling me to the recovery room and they told me that I could hold him. They put him on me and I felt like I was friggin' high. And I'm like, I probably shouldn't be holding the baby right now. I'm so high. And so, that was it just wasn't the best birth experience, I feel like.
So you weren't running a temperature.
No.
Baby wasn't
there was no distress. High, no, absolutely nothing. Everything was totally normal. But, it was 7:00 at night and
she wanted to go home.
She wanted to go home. Yeah. That's exactly what it was. And I didn't know any better. If I had known better, I would have been like, heck no, I don't need a C-section right now. This is a completely, especially for an induced pregnancy. An induced first pregnancy. I mean, that's totally normal. She didn't even give me, I wasn't even in labor for 12 hours. It was 10.
Even ripen your cervix.
Yeah. Oh yeah. We didn't do that or anything. It was just straight Pitocin. As soon as I was dilated enough, they stuck it was a little crochet hook up inside of me and broke my water. 10 hours later, it's okay, I'm ready to go home. Let's cut you open. That's normal.
You're lucky you even made it to 5 that quickly. Usually we have people coming in for these first-time mom inductions at some crazy early gestation of 38 weeks or even 37 for gestational diabetes or some crap like that. And they're there for 3 days and then usually end up in a C-section.
It's horrible.
It's crazy.
Well, and if I had known, I'm sure if somebody had told me, oh, you shouldn't get induced, the risks, blah, blah, I probably wouldn't have even listened anyway, but.
Right. You just want to have that baby.
Yeah, exactly. It'll probably be fine. Well, now I'm totally no, with all of my others, I'm like, no, I do not want to be induced unless it's absolutely medically necessary, because it just increases your chances for a C-section when your body's not ready.
Right. Oh yeah, 100%. We see it all the time because I'm on a high risk unit, and they bring people in for, preeclampsia or uncontrolled diabetes or whatever, and they're there for so long, and then nothing happens, and they're wondering, why is nothing happening? Oh, we broke their water way too early, and now they're developing choreo or like an infection in their uterus, and the baby looks like crap, and then mom starts to look like crap. So like, oh, well, now we have to go do free.
Yeah, now it's an emergency. Yeah.
So that makes me so mad.
Yeah, definitely. It makes me mad looking back. And then I guess I'll just move on with after I had him. Obviously, since we had issues getting pregnant, our plan was that we would just wait about 3 years and then we would do the fertility specialist thing again to try to have another baby. I did not get back on birth control because we had tried so hard and spent all that money on a fertility specialist. That seems like it would have been a dumb thing to do. But when Jackson, that's my oldest son's name.
Oh, that's my little one.
Oh, really? When Jackson was 6 months old, I just remember being so tired. I felt like a zombie, and which, that's normal. You have a baby, right? And I ended up going to the doctor. I was thinking maybe that I was having some like postpartum depression. Like, why am I falling asleep all of a sudden in the middle of the day? And
was this the same doctor?
This was not. So by this time, yeah, right. By this time we had moved actually to North Carolina. So originally I'm from North Carolina. We had moved to Florida where his parents were, my husband's parents were, for just a few years. After we had Jackson, he lost his job down there and we ended up just coming back to North Carolina.
Oh, okay.
So we're in North Carolina. We have this 6-month-old. And I ended up going to just a family doctor. He didn't even give me a pregnancy test, mind you, which I feel like is really weird looking back now. Yeah. He just was like, oh, you know what? It's probably postpartum depression. Like, here, have some Prozac.
Wow.
Yes. So I had this prescription for Prozac, but I had these friends that are like, you sound like you're pregnant. And I'm like, no, I'm not pregnant. I can't get pregnant without for a fertility specialist. So it's not that, but I humored them. I was like, okay, I'll get this stupid test. I'll humor you. I'll take this test. My husband wasn't even home at the time. I just really knew that it was going to be negative, but I took it and lo and behold, I was pregnant with my second. I had this 6-month-old and
I can imagine.
Yes. And I wasn't really upset or anything since we tried and we had problems with the first one. It was kind of like, it felt like a blessing, like, oh, okay. I mean, obviously we didn't plan for it to be that close together, but at the same time, it's like, wow, maybe I'm fixed. Like I can actually get pregnant. So that was exciting. When I was pregnant with her, I ended up going into all of these groups on Facebook for VBACs. I wanted to learn. It was completely different than my first pregnancy. I wanted to learn. I wanted to know about birth. I wanted to know like what I could do differently this time. How I could end up having a VBAC. The first thing that my mother-in-law said, I remember when we called and told her that I was pregnant with Caitlin, my second. She's like, well, you're going to have another C-section because they're so close together. I'm like, no, I'm not having another C-section. I'll find an OB that's willing to help me with a VBAC. So I ended up interviewing several obstetricians. I did see one that was completely like, no, I will not help you have a VBAC. Like that's an insurance liability. Like he said all this to my face. Like he was really rude. But then I finally found one who was like, yeah, my wife has had 2 VBACs. I'm completely a proponent for VBACs. He even said, I remember, I love this part. He was just like, okay, there is around a 1% chance of a uterine rupture when you've had a C-section.
Oh, you said 1%?
Yeah.
Oh. Okay.
And so he was like, okay, instead of focusing on that 1%, I'm going to say, if there was a 1% chance for rain tomorrow, are you going to carry an umbrella?
That's a very good point.
Yeah. So he was like, you know what? It's really a low risk. I will add, I did a lot of research on whether or not that risk was actually increased because of how close together my pregnancies were. And there are not very many studies But what I could find was that it did look like my risk for uterine rupture was about 3.5% because my pregnancies were closer than 18 months apart. So
I did read that. I was kind of like researching before you got here, and it had said that short interval pregnancies did increase your risk. Like it made it a little
like
bit.
A normal person that's had a C-section and then, 2 years later they get pregnant. They really only have, it's a less than 1% chance of a uterine rupture. But for me, since they were so close together, it was increased a little bit, but that was my risk to take, and I had a hospital birth and everything, and I wasn't very afraid. But so I had this OB who was actually really supportive. I liked him. I ended up having a friend that was willing to be my doula, which not in a serious capacity. I didn't pay her anything, but she
wasn't actually a doula.
Right. Yeah. She wasn't like actually a doula, but she was going to school to be a midwife actually. Oh, okay. And so she knew a lot about birth, and she had a home birth before I had Caitlin. We were pregnant at the same time. So she ended up coming to the hospital and being my doula while I was in labor. And that doctor was completely different. So this whole pregnancy was different than the first one. It was so easy. I remember being, I was like a week until my due date. I remember sitting at a coffee shop with my friend. She's like, "Can you believe that you're going to have a baby in a week?" And I'm like, "No, I really can't. I feel so good. I feel like I could just keep going for weeks." I was small. I was still sleeping on my stomach.
Ooh.
Yeah, like my stomach wasn't that big. I just felt great. And anyway, that night, my water ended up breaking. Wow. So I went to bed. I remember it was 4th of July because, when you're pregnant around a holiday, people are always, I don't know why they say this. They think it's funny, but they're like, "Oh, you're going to go into labor on this holiday." Like, why do they say that? It's so dumb. So anyone's like, "Oh, you're going to go into labor on 4th of July. I remember going to sleep that night and thinking, well, I didn't go into labor on 4th of July. And then I ended up waking up at like 12:30 a.m. I rolled over and I felt this pop and I jumped out of bed and it just gushed out of me. And and then I was so excited, of course, like my adrenaline's running. Because before with Jackson, I didn't even go into labor. So I didn't know what any of this was going to be like. But I figured any moment my contractions were going to start, right? So I started,
famous last words.
Yeah. I started piddling around. And mind you, this was like 12:30 a.m. My husband didn't even wake up. Like he was still sleeping. I nudged him. I'm like, "Honey, my water broke." And he's like, "Really? Okay." And then he went back to sleep. Like that was like, let me know when something more exciting happens. So I'm like,
"Run, we gotta get in the car." Like,
right.
now.
Like we need to go to the hospital. And we had Jackson too. So we had to like make sure that my parents could come and watch Jackson but nothing happened. So I was up. I was, making sure my bag was packed. I'm like making all the laundries folded and
cleaning the floor after you broke your water all over it.
Right. I'm like wearing a pad, I'm like carrying a towel around the house. And I went online and went to all my birth groups and told everybody that I'm in labor, but really I wasn't. Like I didn't have a single contraction. Nothing happened. So anyway, and Matt slept. My husband's name is Matt. Matt slept and then he ended up getting up at the normal time and still nothing was happening. I wasn't having any contractions. I was having normal gushes, like, my
coming
water
and going.
Yeah.
Probably were, you just didn't know it maybe.
No, it was. It was just like sometimes I would stand up and like water would come out again. We tried to go for a walk. We walked around the neighborhood. Just nothing was happening. So my friend, the one who was going to school to be a midwife, she said, I can't even remember what time it was. This was probably around lunchtime. So it had been 12 hours since my water broke and nothing was happening. Like I didn't have a single contraction that whole time. So around lunchtime, she was like, "Okay, I'm going to call my chiropractor. And I swear by chiropractic care, I want you to go in and get an adjustment and see what happens." Now I was not a believer. I had never been to a chiropractor before. But at this point, 12 hours later, I was like, yeah, I'll definitely try whatever voodoo you push in my direction. So I ended up going to a chiropractor. He adjusted me. I don't know. He said my sacrum was off. I don't know, whatever was happening, but he did adjust me. And I'm not kidding you, like 30 minutes later, bam, I was in labor.
Wow.
So I get home, I am like balls to the wall in labor. It started fast, like really painful. I labored at home for a while, but when I started like feeling shaky, my friend is like, okay, like, let's go ahead and let's get to the hospital. So we went to the hospital, but I can't remember how dilated I was, but I really want to say it was only maybe like 3. It wasn't, even though it was so painful, it wasn't really progressing very well. And she was also sunny side up.
Oh yeah.
It was, the back labor was so painful. And okay, so I had been laboring, I had regular contractions for hours now. It had been about 3 hours before I went into the hospital. And I remember getting there and they're like, we need to do a swab to make sure that your water broke. I'm like, listen, my water broke. I was like, just watch me seriously for like 5 minutes and you'll see water gush all over the floor. But they did want to do that stupid swab. And so anyway, what ended up happening was all of a sudden my labor just kind of fizzled out. I got there and they like were throwing all this paperwork at me, like sign this, do that. And I have anxiety anyway. And I feel like just all of the crazy and everybody, you know, talking to me and asking me all these questions and fill this out and let's stick this needle in, everything just kind of like, you know,
it's
what?
Too much.
Yeah. So all of a sudden my labor just stopped. Eventually it kind of like would pick back up again. And you know what the weirdest thing too was? It would pick back up again. And then as soon as that my OB would walk in the room, it would stop again. Like my body was like, no, you are not.
White coat syndrome.
Yeah. Like maybe I remember being in the middle of labor. It had been hours. I remember begging the nurse, like, don't let the OB back in. I'm actually progressing when he's gone. Like, do not let him back in. But that was a seriously long labor. My midwife friend, she was against epidurals and I was in so much pain. I really just wanted an epidural. And it had been so long, you know, because I didn't sleep. I woke up at 12:30 a.m., you know, and with the adrenaline, I couldn't go back to sleep. So by this time it was nighttime and I hadn't slept this whole time. And I had been having seriously painful contractions. I just wanted an epidural. And my friend's like, oh, well, what about Stadol? Don't you want to try Stadol? And I'm like, oh, you know what, whatever, just give me the Stadol. I just need something. So they gave me a dose of Stadol and it probably affects everybody differently. But for me, it just felt like it was almost like I was sedated. Like I could feel everything and it was still super painful, but I was too out of it to voice how painful it was. I was too out of it to tell you and yell at you, but I still felt everything. So when I finally got out of that Stadol stupor, my friend's like, do you just want another dose of Stadol? I'm like, no, I made a mistake. Give me the epidural right now. So I did. I got the epidural. And I think by this time, I want to say I was a 5. So I'm still like not really that far dilated, right? And I remember being afraid that like maybe I just have to have another C-section, you know, but my OB was really good. He was like, no, I know you want a VBAC. He was like, we're not talking about C-section yet. He was like, why don't we try a little bit of Pitocin? I want you have the epidural. Let's try a little bit of Pitocin and why don't you go to sleep? And so I was like, okay, I could go to sleep. So I did. I went to sleep. I remember waking up around 7:30 and my epidural had worn off a little bit. I could start to kind of feel the contractions, but they still weren't super painful. I could just like feel that it was there. Yeah. Mm-hmm. I just remember feeling really, really giddy. Like, I think I'm probably ready by now.
Really excited.
Like I never pushed a baby out of my vagina and it wasn't painful right now. So I was like, you know what? This is really exciting. So the nurse came in and checked me and alas, I was a 10. Like it was time to push. And everything just like went fine. The only weird thing was when I was pushing, I really only pushed, I don't know, maybe for 20 minutes. Like it wasn't that long, but you know how usually the baby comes out, like the head comes out and then another push, the shoulders will come out, right? Not with Caitlin. It was just kind of like she was crowning and then she just shot out.
Ooh.
So yeah, I tore a little bit, but it wasn't bad. And it was amazing. It was a completely different experience. They laid her right on top of me and I got to snuggle her for probably a good 30 minutes until I told them like, okay, like you guys can weigh her and do whatever you want to do now. So I got to like try to breastfeed her right away. And it was just what I had expected with the first birth.
Right.
That was my first VBAC. So by this time, clearly we knew that I could get pregnant on our own.
Need anything again or?
So what did I don't know why I didn't get on birth control. Let me think. I did get on birth control. You know, I actually got the Mirena put in. I got the Mirena put in and I started having really weird symptoms. I'll tell you, it didn't seem like it would even really have anything to do with the Mirena. I started getting like joint pain, right? Okay. So first my knee felt like I needed a knee brace. Like my knee was bothering me. And then it was my wrist and then my other knee and then my thumb. It was just like one by one, all of these things kept happening. And it had been about 4 months. By 4 months, I was like hobbling around like a 70-year-old woman. And
it all started after your IUD.
Yes. But I didn't put 2 and 2 together until I thought back. I'm like, what the heck happened 4 months ago? And I thought about the Mirena and I'm like, no, that's dumb. Like what? That wouldn't have anything to do with this.
Right.
But you know, it was worth a shot. Like maybe it is. I'll just take it out and then we'll just see what happens. I took it out and I'm not kidding you. Within a week, all of that weird joint pain just went away. So
that's so weird.
So I did have birth control. One of my midwives, she ended up saying that she thought maybe it was like a buildup of progesterone. Like maybe it was because I had too much progesterone when I had that IUD in. I don't know. That was just her guess because it sounds so weird. Right. But if I had constant pain that was progressively getting worse for 4 months and then all of a sudden I take this out and it goes away, it had to have been that. I don't know why. I don't know the science behind it, but
maybe something to do with your PCOS or something.
Maybe. So I did try birth control, but then I took that out and then we decided to try natural family planning. So basically it was like the rhythm method. Mm-hmm. So I would take my temperature and we would, write on the calendar when I should be fertile and all of this. And we just wouldn't have sex during that time. I ended up, I remember I was getting these cramps and it was around time that I should have been starting my period. And we had been having, safe sex this whole time. And I got this new job. I hadn't worked since I had my first. So I got this new job and I was really happy. I wouldn't say that we had sex to celebrate, but we were going to have unprotected sex because I was about to start my period. So we didn't have to worry about anything. Well, for God's sake, 2 weeks later, I got a friggin' positive pregnancy test. So apparently those cramps were not my period, but it was ovulation. Like wonderful.
Implantation, maybe.
So lo and behold, that's how we get my third, Addison. And that pregnancy, I ended up deciding I really wanted to go the midwife route. I actually tried to find a home birth midwife, but in North Carolina, it is very difficult to find a home birth midwife. 1, 2, if you've had a C-section, it's pretty much impossible because the way that they're, they have to be under an OB and there are a lot of rules insurance wise and all of this. So basically home birth midwives will say, no, I will not take a VBAC. Like I cannot take a VBAC. So I could not find a home birth midwife, but I did find a midwife group that delivered at the hospital. And so I decided to try them. So my whole pregnancy, I went through these midwives and it was just like a breath of fresh air. It was an amazing pregnancy. They're very naturally minded. I remember at the end of my pregnancy, I was actually begging her to give me a, what's it called? A sweep.
Oh yeah.
A membrane
like
sweep.
membranes.
Yes. And like, she didn't want to. She's like, I mean, I will if you want me to, but there's really no, I don't feel like there's any point in doing it. I mean, you're going to have the baby when you have the baby, like she was totally, I'm just like, just do it. I just want to have this baby.
Right.
But super, super chill and super, like there was no talk about induction. It's kind of like, okay, well, we can talk about it if you go a week late, then we'll kind of start talking about it, but we don't need to talk about it before then. It was nice.
Yeah.
I ended up going into labor and the same exact thing happened where I was in labor and I made sure that I waited until everything was consistent, and I would say that they were like 4 minutes apart. I can't remember now, but everything was consistent. And that's when I went to the hospital. And again, as soon as I got there, they threw all the paperwork at me and all of this stuff was happening and it just kind of fizzled out and went into nothing. I just think it's like an anxiety response.
Probably. Because I say you go into labor at night because you're sleeping and you're relaxed.
Right.
And it's because you're not like high stress and tense.
Right.
So, I mean, it makes sense.
Yeah. So I got there and it just kind of fizzled out. And okay, so my parents at this time were living 2.5 hours away and they had to drive 2.5 hours. So I definitely made sure that I waited until everything was, I definitely was in labor. I called them. They drove 2.5 hours to my house to watch my other 2 kids. And then we had to drive an hour to Durham, which is where the hospital was. So when everything fizzled out, they wanted me to go home, like, just go home and it should pick back up. And I'm like, I'm not going home because
how dilated were you?
I don't even know.
Probably not.
It was very negligible. Yeah. It was enough. It was so low, they were like, go home, I mean, they believed me that I had been in labor, but there's no point in just like staying at the hospital. If, it just kind of fizzles out, you can just go home and wait. But I'm like, you know what? My parents drove 2.5 hours to be here. And then I drove an hour here. Just let me stay and I'll walk the hospital and see if it can pick back up, So that's what we did. And they were fine with it. I walked to the hospital and I remember hearing the babies crying and thinking like, I'm really going to have one of those again, huh? Like this is real. And what happened was they did kind of start picking back up my contractions, but they were super inconsistent. So I would have one and then 20 minutes later, I'd have another. And then 5 minutes after that, and then 8 minutes, and then 30 minutes. They were just kind of all over the place. And I ended up asking the midwife, what if you just broke my water? This is my 3rd baby. Just let's see what happens. And so she said, okay. So she broke my water and then it was game on. Like it just came on hard and fast and
so no Pitocin.
No Pitocin.
Wow.
Nope. It was just like, bam, you were definitely in labor. So I was in labor for a few hours. I was begging for an epidural. They tried a couple different things. They tried, you know what a TENS machine is? Mm-hmm. Okay. So, the midwives are all pretty hippie and she brought in like essential oils and she was actually amazing. So this is different than an OB. The OB is usually like, they come in and they check you and then they leave. And it's kind of the nurses that are just the ones that are with you. Oh no, not this midwife. I mean, she was with me. She was like massaging me and, she stayed with me. She went and got her TENS machine. So she tried that. Nothing really helps when you're in labor. Like you can try all of these things, but my God, like, no, nothing really helps.
Especially if you're like transitioning. That's nothing. Like you just want like fight or flight. You just want to go.
Yeah. I was screaming. I remember screaming like, I need the epidural. I don't want to feel that again. I don't want another contraction. So she ended up getting the anesthesiologist in and the anesthesiologist gave me the epidural. And then they checked me. So I was so pissed because she didn't check me beforehand, but I can't blame her because I was really freaking out. I was like a monster. Like, don't touch me again. I just want the epidural. Like nothing else matters to me right now. So anyway, they gave me the epidural, checked me. I was already an 8.
Yeah.
So then it was not even an hour later and I was a 10 and I was ready to push and she came out and that was it. Yeah. So I was trying to think maybe I should tell you that she came out. This is kind of a funny story. So all of my other kids are blondes. Which, and Addie, my third, she actually is blonde now, but I'm not kidding you. When she came out, she looked like she was another ethnicity. Like she had dark hair, like black hair and just, I don't know, like a puffy face. She kind of looked like she was maybe Hispanic or something.
With olivey skin, maybe.
Yes, olivey, and she still has olivey skin. Mm-hmm. And so I am not kidding you. When she came out, the midwife looked in pity at my husband and my husband looked at her and like, they really thought that this child was not my husband's. And to prove that point again, when I went to her first newborn appointment, this was at a completely new doctor. I tried to like go to a doctor that was closer. So I went to this completely new doctor. My husband wasn't with me. And I'm not kidding you. The doctor was like, "Oh, is your husband Chinese?" I'm like, no, like, why does everybody think this child is another ethnicity? Like, she's totally white. Like, so my husband still jokes about this to this day. Like, he jokes that she's not his. And now, I mean, she has blonde hair and blue eyes. Like now, she does kind of have this olivey skin, but my mom's Italian. So, I mean, I guess it does run in there somewhere. Yes. So, but yeah, when she was born, I mean, my midwife and my husband looked at each other like, she probably tells people, this is probably the story that she tells people, like, I delivered this baby and it totally wasn't his child, you know? Poor bastard.
I've had that a few times where I'm like, baby's not nearly like,
yeah, like something's wrong here. Like she didn't want to be the one to tell him, but that clearly wasn't his child, right?
But I remember after my first, because my husband's Black, and as you know, and they, you know, all my boys came out fairly light but dark hair. Mm-hmm. And my first one, I was 21, almost 22 when I had him, and the nurse was giving him a bath, and I said, "Why are his balls black?" And she just looks at me, and my husband was like at work or something that day at that point, and she's like, "Usually that indicates the color of the father." I'm like, "Oh, okay." And
oh, that's good.
She was like, I think she thought I was relieved, like, "Oh crap, I wasn't sure."
Right. Like, whose baby is this? Oh my gosh.
So yeah, I get that.
Yes. So we decided that was going to be our last baby, which she wasn't because we have a fourth, but that wasn't an unexpected pregnancy like the others. It was just when she turned 2. I don't know if baby fever ever really goes away, but for some reason, whenever the kids turn 2, it's like, oh, I need another one.
Yep.
They start losing that babiness, you know, and you're just like, I need another baby.
Yeah.
So that's kind of what happened. I begged my husband, like, we just need to have a fourth. We just have to make it even, you know, like, what if when we go to Busch Gardens, like, it's like a 2-person ride and one of us is left out by ourselves. Like, we have to have an even number. So, but he's still
a good point.
Right. Exactly. And, you know, everybody that I talked to was like, oh, the fourth, you know, you don't even know that they're there. Like, oh, the fourth is so easy. So, and I was telling him this, all my friends said this, just, we need to have the fourth, but he was totally against it. He did not want to have a fourth, but I was not on birth control. So I'll say he took the risk by having sex with me. And you know, I knew when I was ovulating and he partook in that activity.
You may or may not have mentioned the fact that you were ovulating.
Yeah. You know, and I had given him forewarning, like I did want a fourth. So, you know, I don't know. It was deceitful, but it was a little bit,
you know,
it was a little bit his fault.
You did it.
Yeah, he did it. He was an active participant. So and oddly, that was like the very first time. I mean, I actually took an ovulation test. I was ovulating. We had sex. Boom. Like I ended up being pregnant.
Wow.
Yeah.
So you're like fertile. After having fertility issues, you were one fertile girl.
Yes. Very fertile, apparently.
Fertile Myrtle.
And this time I still really wanted a home birth. I mean, I had wanted a home birth previously, but I couldn't find anybody to do it. So anyway, this time I really wanted a home birth, and I had found out that there were midwives in North Carolina that are actually not legal. They cannot legally perform home births. They are not CNMs. They don't have an OB over them, but they are CPMs. So I think that stands for Certified Professional Midwife.
Okay.
So in some states, they can practice legally. But in North Carolina, they cannot. In North Carolina, you have to be a certified nurse midwife. And to be a home birth midwife, you have to be under like an umbrella of an obstetrician who will like have you under his insurance. So anyway, clearly I had already had these legal midwives tell me no, but I figured it wouldn't hurt to talk to one of these quote unquote underground midwives, these illegal midwives, to see, I don't know what it was like how much they would charge. I mean, obviously this wasn't going to be covered by insurance if I was doing this under the table. And what did they do? Like, do they have a birth assistant? Like, what do they do in case of an emergency and all of that? So anyway, I set up this appointment to interview a CNM, not a CNM, a CPM. So I had an interview with her, and she was willing to take me. I want to say it was like $3,500. And that's
not bad.
No. Yeah, exactly. And I mean, she could get in serious trouble. So I kind of was surprised that it wasn't more than that. But anyway.
Yeah.
But she happened to be working for another local midwife who was an actual legal home birth midwife. She was working as a birth assistant. So she said, you know what? I feel like you've already had 2 totally normal VBACs, no complications, no nothing. You're a really good candidate. Let me just talk to her and see if she would be willing to take you, because I don't see really any reason why she shouldn't. So that's what she did. She talked to this CNM, and the CNM ended up having an interview with me. And she basically said the same thing. She said that she would talk to the OB, but she didn't see any reason why she couldn't take me. Just the only thing was that I was going to have to be quiet about it. And here I am on the podcast. Yeah. I did not sign anything, and I won't say her name, but, but yes, she was like, okay, but just don't like go and tell all of your friends that you're having this VBAC with me, and don't, tell other VBAC moms, because honestly, she's not supposed to take VBACs. Right. So anyway, she took me on, and it was actually amazing. Her office was not that far from my house. At the end of the pregnancy, she actually came to my house for appointments.
Wow. Is she in our town? So she wasn't in our town.
No, she was not in our town. But she was nearby. Okay. And she was, I don't know if she is anymore. She didn't like live near town, but her office was kind of nearby. Anyway, so she actually came to my house, which was amazing because, I have 3 kids, like 3 young kids at that time. And she came to my house for the appointments at the end, and everything was normal. One of the questions that I always get about it is, do they do all the normal stuff? Like, do the midwives do all of the normal things at the appointments that, an OB would? And the answer is yes. Everything was the same. It was a little bit different. So I'd go to her office, and instead of me peeing in a cup, I could just do it myself. So she had the strips like in her bathroom, so I could just, pee and dip the strip myself. Yeah. And I weighed myself, and we would talk, and she would do all the normal stuff. The only thing she couldn't do is like the anatomy scan, but I just went somewhere local to a local OB, and they did the anatomy scan and
they ordered it.
Mhm.
Like, okay.
Yeah. And she even did, what's it called? Like the glucose tolerance test. I did it right there at her office. Yeah, I mean, all of the normal things that you have, she did all of that. And even at the birth, okay, so the birth was it wasn't normal, obviously, because I was at home.
Right. Well, not normal in most people's eyes.
Yeah. I mean, if you're overseas, it's totally normal to have home births. And anyway, the pregnancy was a really good experience. When I was at the end, the other cool thing is that they give you a birth pool.
They give it to you?
Well, yeah, it's like you can use it, so they give it to you at, I don't know, I think it was 37 weeks.
Oh.
They have the appointment that you normally have. They come to your house and do the appointment, and they bring all of this equipment. They give you this birth pool that you can set up so that when you go into labor, you have it. And I had this like birth kit, and I didn't even look at it. I don't even know what was in it until the day that my water broke. I had been in labor. I can't remember what it's called when you kind of like keep going into labor at night.
Prodromal labor.
Yes. Mm-hmm. Oh my gosh. This was the first pregnancy that I had that. And it was so annoying. My husband,
you, though.
Yeah. Yes. I think that did help. But my husband was working out of town, and he used to work out of town all week. So he would leave on Monday and he wouldn't get home until Thursday. So this would, of course, always happen when he was gone. So I'd wake up in the middle of the night and I'd be having contractions, and I'm thinking, should I call him? Do I call him and make him come home, or is this just going to go away? Right. So that happened for 2 weeks. And then finally I was having contractions one day. It was like a couple days after my due date. And I was standing up in the kitchen and I felt a pop, but not really a lot of fluid came out. So with my second, when my water broke, it was so obvious. It was like, the pop and then a gush. Mm-hmm. Well, with Owen, my fourth, I felt a pop and I had a little bit of wetness, but it could have totally been pee, So it was the classic, did my water just break? Or did it not? I don't know what that was. So I texted my midwife, and she told me that in my handy little birth kit was this Q-tip looking thing. And she said to roll that around in my underwear where it was a little bit wet. And if it turned, I think blue was the color. If it turned blue, then it's amniotic fluid. So I did that and it turned blue. So I was like, oh, okay. So this is happening. Tonight's the night. And so they ended up, my midwife and the birth assistant, which was actually the other midwife. She came, and everybody just kind of hung out while I was in labor. They filled up the birth pool, and it was just kind of like slow and steady. Actually, I applied to be on birth tube. Do you know what birth tube is?
Yeah.
I did the introductory video and all of that, and I was totally going to go live. So I did. I have, if you go on birth tube, I mean, maybe you could find it still. Mm-hmm. I have a video of the first half of my labor.
Oh, just the first half?
Yeah.
You're like, forget this.
You're right. Yeah. Turn it off. No one needs to see this. No, I ended up turning it off because, I needed to walk around because it was kind of like with Addison, with my third, it was just kind of all over the place, really inconsistent. So my midwives were like, well, why don't you walk around the house, go up and down the stairs and do some of that and see if it kind of helps bring everything together. So I turned off the video, the live video, and the walking and the stairs, it definitely did help, because then by the time I came upstairs, I did not want anybody watching me on the video. I was just like an animal. I think the whole time I'm just like, please, God, please. Oh, Lord Jesus, please. My husband is the worst birth partner. I will tell you this. You would think by 4 babies, he would be a really great birth partner, but no, he just kind of stands in the corner with his eyes wide, like he's afraid of me. That is. And so So that's like what he did, he's just like staring at me and oh my gosh, and it's so painful. So this baby was there must be something about this baby, my baby's being like posterior, sunny side up. So he was posterior. And I went in the birth pool for a while, and I will say that it helps. I mean, it's not like it completely takes the pain away, but being in the water definitely does help the pain.
Yeah. Probably helps relieve some of that pressure, I would think.
Yeah.
I've never done it, but
like my belly wasn't so heavy. It was kind of like floating. I mean, the contractions still really hurt, but it also like was kind of another element to distract you. The water was kind of distracting. I don't know. Mm-hmm. So I labored in the birth pool for a long time. And then when it came time to push, I tried when I was in the birth pool, but it was kind of like I couldn't get good traction. I don't know how to explain it. The sides are like, sliding. Yeah. Mm-hmm. So after a little bit, the midwives were like, well, let's try to get out and maybe try on the bed. So I will tell you too, by this point, I was like, I was actually really thinking, okay, could we get to the hospital for an epidural now? Like, is it too late? Like, why have I done this to myself?
Transition.
Right. But of course it was too late. And really this labor was not very long at all. I think I turned the birth tube video off at like 11:30 and he was born at like 3:00. So in the grand scheme, it was really only a few hours of hard labor and pushing. I pushed a lot longer with him than I did with the others for some reason.
It was more painful.
Who knows? Maybe. Yeah. Cause the others I had the epidural, this time. Oh my gosh. It was a shit show. Oh my God. I got in the bed. I tried to push. Finally the midwife, I remember her saying, well, what do you feel like you should do? And instinctively, I just kind of jumped off the bed and squatted next to my bed. So I was like holding on to the side of the bed, just kind of squatting. And I felt like I could really actually get traction that way. And I could feel him coming out. And it was horrific. Why does it feel like the baby's coming out of your butthole? Like, that's what it feels like. My butthole was tearing. I mean, I was just screaming. Oh, and get this. So I'm like screaming, my butthole, like it hurts. And my friggin' husband in the corner says, we know. Yeah. Yeah. Like he says, we know, like I shouldn't be talking about how much pain I was in. I could have throttled him. And I still think about that. This is why I won't have any more babies because he's such a terrible birth partner.
Like if you had a knife near you, probably would have whipped across the room at him.
Yeah. Yeah. Oh my gosh. He's so terrible. He even was like, the neighbors even know. Like, and I'm really surprised, mind you, having a home birth, all of my neighbors did probably hear this because you can hear, it's like, we're kind of close together. I am so surprised that nobody called the police on how bad I was screaming, and it's in the middle of the night. And none of my kids woke up. All of my kids slept through this whole thing. And I am like screaming like a wild banshee. Anyway, so I got down and I was squatting next to the bed and I'm pushing and I knew I was tearing, but I just didn't care. I mean, I'm like, I just have to get him out. Right. So I just kept pushing through everything. And so the midwife is like right behind me. And looking back, I feel like I should have reached my hands down and felt or something, but I didn't. And remember how I told you that with Caitlin, the head didn't come out first. She just kind of shot out. Mm. Well, that happened with Owen, but nobody caught him. So the midwife is right there. And it just happened so fast. My husband, it was like, oh my God, he bounced off of the floor. So luckily I'm really short. I'm only 5'1" and I was squatting. So it wasn't like a huge drop or anything, but yeah, totally. Nobody caught that child. He just bounced off of the floor.
Oh, geez.
So he
should have to fill out an incident report for that or something.
Right? Like, I mean, I guess they're just kind of like jelly at the beginning anyway.
Yeah.
Pretty rubbery. I don't know. He was fine, I think.
He's okay now.
He's like my most ornery child. Maybe that had something to do with it. I don't know. He did come out and I did hemorrhage. So, I mean, I don't really remember it. It wasn't this big dramatic thing. It was just kind of like after I had him, they got me on the bed and my husband's like, they're all looking at me. There's 3 people. It was like my husband and the 2 midwives and they're all just staring at me. And my husband's like, is she supposed to like be bleeding like that? And the midwife was like, nope, that's kind of too much. So she had this shot that she put in my leg, I guess for hemorrhaging. And then they just kept staring at me for a little while to make sure that it stopped hemorrhaging.
Like massaging your belly. And-
No, they were all just staring at me. I'm like laying in the bed and these people are all just staring at me. I did have the baby. I had the baby on my chest. And so I did stop hemorrhaging. And then they went to like assess the damage. No, I did. I had to have the placenta first, but I never feel the placenta when it comes out. Like it doesn't hurt or anything. I was just holding the baby and
you're focusing on the baby.
Yeah. They like massaged my belly and the placenta ended up coming out. And then they assessed the damage that was down there. And it was very disconcerting because apparently there was a lot of damage. So it was almost a 4th degree. One of my labia was like hanging off. No joke. Like my labia tore off. Yeah, it wasn't good. And I love midwives. I'm not trying to say anything bad about midwives, but when you have that kind of damage down there, I guess if you could choose, you would choose an OB, like somebody,
a surgeon.
Yeah, a surgeon to kind of fix everything. And they weren't super confident when they were stitching me up, right? So one of them
staring at it like,
Yes, and like asking the other one for advice and like, is this good? Like, and then the other one like try. It was,
oh God,
yeah. I mean, I don't think that they're used to that. Tears that bad because, normally when you don't have an epidural, you like kind of do it slower but not me, me, I'm just like, just get this thing out of me. Yeah. So anyway, they did stitch me up and they took care of everything. Like they cleaned up the birth pool. They cleaned up all of the mess.
Wow. They take it out with them, I'm assuming.
Yep. They took everything with them. So they were there for a long time. They did all of the normal checks for the baby. They even do like the vitamin K shot and all of that for the baby. Everything was really normal. And then they left and they came back in the morning to check again, on me and the baby. And they do that little like PKU test, the heel prick for the baby, just like if you're at the hospital. They even did the hearing test. They have like this little machine. So really, I mean, the home birth, they can do all of these things. I mean, they can't reel me back to an OR and give me a C-section clearly, but there's so many things that they can do that I didn't even realize that they could do before I started researching home birth.
And that was all covered by insurance.
So what happened was I had to pay her up front. Okay. And then after the birth, she filed insurance for me. And then I got a check, like a reimbursement.
Wow.
So but it wasn't like 100%. I have a high deductible. So it ended up being, I think I paid her $4,000 and then I ended up getting $1,500 back. So that's still that's not terrible. I mean, it's not that much different than what would have happened if I had been at the hospital and paying an OB with a high deductible. Right.
Right.
And I got to just be in the comfort of my own home and I didn't have to find childcare for my children and
people could come see the baby right away.
Oh, right. Yeah. Like all of my kids just kind of piled in the room that morning and
what happened last night?
Yeah. Yeah. Like, oh my God, like he's actually here, right here in your bed with you. My my daughter, Caitlin, she came in, it was probably like 6:00 in the morning. I was exhausted. I hadn't really slept. Of course, after I had the baby, guess who went downstairs and fell asleep on the couch? Matthew. Yeah. Like he was like, okay, that was fun. I'm going to go to sleep. And here I am with this like newborn. I'm so utterly exhausted. But anyway, and then Caitlin comes in at 6:00 and She was so enamored by the baby. She like came and laid next to me and just stared at him for hours until everybody else woke up. It was so sweet. And her and Owen, they actually still to this day have a really special connection. They just, not to say that they love each other more than the other siblings, but there definitely is a connection there.
Yeah.
And my first and my third kind of have that too. A different connection, a different dynamic than the other two.
That's awesome.
Yeah.
I wonder if we had a fourth, like how it would be. Cause like they were like much older than my third. And like my oldest is like very like in tune to like the baby. Like he's very like, acting like he's like a little daddy. Like he tells me to be careful with him. Make sure you do this. I'm like, excuse me? Like I know what I'm doing, but so I can see that happening.
Yeah. Caitlin is like a little mommy to Owen, my fourth.
And what's the age difference?
So Caitlin is 7 and Owen is 2. So all my kids, my oldest is 8. So 8, 7, 5, and 2 are the ages.
Okay.
Currently.
Wow. And you guys are done.
We are actually done. So Matt did not trust me after that, and he went and got a vasectomy. So we are definitely officially done. But I feel done now. Of course, now that Owen is 2, I do like see other babies, but I don't really want another baby.
Right.
I feel like we're complete. 4 is a good number. I mean, 4 is a lot. Yeah. I didn't bring it with me here today, but we actually drive a big transit van, like a passenger van.
Oh, wow.
So if you ever see the silver bus driving around Clayton, that's me. Wave hello. It even has a sticker on the back that's like, honk if a kid falls out.
That's awesome. Yeah. You need that, like with that many?
So, I mean, I guess not necessarily. We had a minivan before and clearly we all fit in the minivan, but all of our stuff didn't fit in the minivan. Yeah. There's not really a lot of trunk space. So we like to go on vacations, and whenever we went somewhere, there's not enough room for all of our suitcases and all of our stuff. Mm-hmm. And then last year we got an exchange student, and she was with us for a whole year. So we had 5 children. And it's like, you know what? Like, there's kind of not any in between. So there's a minivan, and then there's a passenger van. Like there's nothing, we really needed a kind of in the middle, but there isn't. So we just decided to spring for the passenger van. And when we took some of the back seats out, so we have a ton of cargo space. So when we go anywhere, I mean, we have plenty of space, even like just going to the beach, you bring the cooler and you have the tent and you have all the floaties and you have all of this. I mean,
towels.
yeah, there's a ton of stuff. And my parents live in town and my brother. So we end up taking them with us all the time places. So we have plenty of seats and it works great. I actually kind of love it.
Yeah, that's nice. I'll have to invest one of those if we have another one.
Yeah.
We have a Chevy Traverse, which I am like obsessed with because we have a third row. We don't use it that often, but if we have people over, it fits a few extra people.
Right. It's nice. Well, even with us like going to BJ's and making a BJ's run once a month, like we don't, the minivan, we had no room for that.
Right.
Now we definitely have plenty of room.
It's a bus. If I see that, I'm going to definitely honk.
Yeah. I have had people honk, and I give them the stink eye because I'm like, I look back, there are no kids falling out. Like, and my husband, there's a sticker on there too. This is from my husband. It says, shoot, now I'm not going to be able to remember exactly what it says. It says something like, clearly I've made some bad decisions.
Oh, that's funny.
So yeah, that's me. If you see that driving
like
around
a fun
town.
Couple.
Yeah.
Oh, that's so funny. Let me see about my question. Unless are you?
I'm good. If you have any questions, I'm ready.
Is there anything that you can recommend that are must-haves to bring you to the hospital? Because I know, on the Clayton Moms group, everyone's always asking this question.
Yes. Goodness. I mean, the only thing that I can really think, the hospital, all of the ones that I gave birth at, they literally have everything. I mean, they even have diapers, and they even give you the padsicles after you have the baby. And they even gave me, you know what the best thing, what for me was, you know, that spray, I can't remember what it's called. Yes. Dermaplast. That stuff is amazing. One of the hospitals I gave birth at gave me that Dermaplast. And so now I make sure that I have it after every birth. One thing that I just did for this fourth birth was, Depends.
Oh yeah. I've seen people bring those too.
Yes. And that was amazing. I don't know why I didn't do it with the others. It was so much less messy. And then you just throw it away after. You don't have to deal with a pad like sliding around. Yes. So the Depends, even though you may feel really dumb getting them at the store, go ahead and get the Depends because they're totally worth it. And the Dermaplast, I mean, just make sure that you bring some comfy clothes. Don't try to like bring no jeans or anything like that. Bring your comfy stretchy pants.
Yoga pants for the next 3 years.
Yes, exactly. I mean, yeah, you don't really end up having to bring that much. Maybe bring some like contraband snacks because sometimes the nurses like won't let you eat and you're starving or something. So just like
especially being a VBAC.
Yeah. So like just hide something in your back. When I was in labor with Addison and I had the midwives, I actually did have snacks in my bag. And I remember the charge nurse being like, you can't eat. And after she left, my midwife's like, you can eat, just don't let the nurses see you. I'm like, okay.
I'll like occasionally be like, okay, like you're not supposed to even drink, but here's your meds. And I think it takes you quite a bit to swallow this one pill, right? And they're like, they kind of look at me and I'm like, right?
That's awesome. That's so funny.
Well, you had a home birth with the last one, but any tips you would give a labor and delivery nurse based on your experiences?
Oh, that's a tricky one. I guess going back to my first labor, probably just, I know some people, I guess, can be weird about people giving them advice. But with my first, I feel like I really would have benefited from them kind of giving me advice, you know, like, well, try this, try that, like, I don't know, they have peanut balls. They have all of these different things that you can try, but nothing was offered to me. I just felt like I had to lay there and do nothing and suffer. There was no, I didn't know what I was doing. I feel like it would have been nice if they helped me more.
Right. Okay.
And then obviously just be understanding. One of the best things about the hospital, I went to Duke Regional for my third. And that was when I was with the midwives, but I delivered her at Duke Regional. And the nurses there were so amazing. When I got there, they immediately asked me for my birth plan. And I had typed up a birth plan. And they never asked me anything again. Like, they just went by that birth plan, and every change of staff or anything, I guess they had it in my file and everybody looked it over and everybody went by it. Even so much as I had on there that I didn't want to have, I didn't want the baby to have the vitamin K shot. Oh. And I changed my mind, but nobody asked me about it. So it was like after she was born, nobody was like, are you sure? Like, they just went by the birth plan 100%. And I had to be like, hey, excuse me, I'm sorry, but I changed my mind. Like, I know I said no vitamin K, but can you give her the vitamin K? Yeah. And you know, obviously they're like, yeah, sure, whatever. Mm-hmm. But they went by the birth plan 100%. And that was amazing.
That's awesome. So they said, like, did they know you had a birth plan, or they just said, do you have a birth plan? Can we have it? Yeah.
They asked me if I had a birth plan. And I remember the midwives had told me that if I wanted to bring a birth plan, they actually like it at the hospital because then they know what you want. So, you know, sometimes like with my second, they were really weird about me bringing a birth plan. Yeah. Like, they were rude and they didn't care about the birth plan, which we all know that it doesn't always go the way you want. I mean, actually, most of the time it doesn't go the way that you want. But every mother is different, and it's nice for them to know what your personal preferences are, right? So, you know, some moms would, I don't know, if they don't really care about Like, okay, give me the epidural, like give me all the drugs as soon as you get there. And that's totally fine. But then there's other moms who are like, please don't offer me an epidural. Like I don't even want it offered to me, and I'll tell you if I need it or, whatever. Like everybody is different. And so it's kind of nice for them to look at that so you don't have to explain it to every single change of staff, right? That it just says on there, like, okay, this is what this mom, what her preferences are. Mm-hmm. So that I really liked that. I guess that's not necessarily just about the nurses, but about the nurses at that hospital. And they were all super respectful of everything that I wanted. It was a really good experience. The only issue I had was with the charge nurse, and she wouldn't let me eat, but she wasn't mean. Right? She wasn't mean about it or anything.
like your nurse told on you, she keeps eating.
Right. Oh, the other thing that I really liked was the fetal monitor was wireless.
I've heard that. We don't have those. I hate ours, but
yes. Yeah. Oh, that made such a big difference. So I'll just say for anybody listening, that doesn't know about this kind of stuff. So at other hospitals, when you have you have this thing strapped around your belly that's listening to the baby's heartbeat. And a lot of times it's hooked up to this machine. So you can't really go far away from the machine. So you can kind of bounce on your ball next to the machine. But if you have to go to the bathroom or whatever, they have to unplug it. And then it's beeping, beeping, beeping. And then you go to the bathroom and come back and you have to get plugged back into it. Well, at Duke Regional, it was wireless. So it didn't matter where I went. I could walk the halls. I could go pee freely, and I didn't have to have anybody, come and unplug me.
Didn't have to adjust it constantly or anything.
No.
That's awesome.
No, it was so nice. Yeah. So maybe, I don't know, that's kind of a cool feature. So you can ask your hospital before you are delivering if they offer that. And sometimes Duke Regional, they only had a limited amount. So I did have to ask for it. Make sure you give me that, hold one of those for me, please. Also, they said, we have these garden tubs, that you can labor in. It wasn't that great. So I tried to get in the tub, but it's just kind of a normal tub that you have at home. And it wasn't really that comfortable. Yeah. It wasn't I don't know. I guess I was kind of expecting it to be more like the birth pool, kind of high, but it wasn't. It was a normal bathtub. My stomach was just over the water, it wasn't even submerged. It was just kind of a letdown.
I can just picture just sitting in a tub,
yeah,
I can do that at home.
Exactly. That's what I was like. I did. This was with my third. I was in the tub and I'm yeah, this isn't going to work.
Maybe how many people have sat in this tub?
Yeah, I wonder how well they clean this. Did they use bleach?
Right.
Yeah.
I know WakeMed and Carrie has beautiful setups.
I've heard.
And you can even wear those monitors in the shower or in the tub, and that's amazing. I wish we had something like that. Ours is the greatest.
I feel that's really awesome for laboring moms, especially the water, the shower, that's what moms want when they're in labor.
Yeah. Awesome. And this is the perfect first story. I'm so excited.
The longest story you'll probably
you have 4 babies. So. I was trying to tell mine before you came here, and I was this is taking forever.
Right.
Even leaving out some of the stuff, it was too much.
I feel and as you're talking, you're oh, wait, shoot, I should have mentioned that. But yeah, there's just so much. There's so much that you could talk about.
Yeah. And you remember different things each time. And
yeah, exactly. Well, I'm really glad that you had me out. This was fun.
Yeah, thank you. We have to hang out other than podcasting.
Right. Thanks.
So, thank you so much.
Yes, thank you.
Thank you so much for listening to this incredible mom story today. I really hope you enjoyed it and that it may have helped you in some way. Make sure you rate and leave a comment so I can be sure to bring you the content that you really want. Please follow the Incredible Moms podcast on Instagram, where you'll also be able to find many updates and episodes. I can't tell you how much I appreciate any support. Stay tuned for another Incredible Mom next week.